Do pain and injury mean the same thing? Find out in this episode of Monday Mornings with Michael. Typically, whenever we experience pain, we associate with some sort of tissue damage. If I'm running down the street and I sprain my ankle, I'll have ankle pain, and that's because I tore one of my ligaments. Another example would be if I was performing a bench press and my shoulder started to hurt, I would think, oh, well, the pain in my shoulder is probably from a torn rotator cuff muscle. However, the relationship between pain and injury isn't always that clear. If we look at the definition of an injury, it means tissue damage. But if we look at the definition of pain, it's an unpleasant sensory and emotional experience in relation to either actual or potential tissue damage. So to experience pain, you actually don't have to have tissue damage at all. If we look at the research, we can see this is actually pretty common. For example, one study looked at the low backs of 3,000 individuals and found that 52% of 30-year-olds had some sort of degenerative disc. When they looked at 50-year-olds, they found that that number increased to 80%. In a different study that looked at the shoulders of 90 individuals, they found that over 50% of those over 70 either had a partial or a full thickness tear of the rotator cuff muscles. And then in another study that looked at the shoulders of 51 individuals, they actually found that 96% of them had some sort of structural abnormality in their shoulders. The subjects in all of these studies were actually asymptomatic, so they didn't have a history of low back pain or shoulder pain, but had some sort of tissue damage. These studies help demonstrate that the relationship between pain and tissue damage isn't all that strong. One example that I like to give to demonstrate that pain doesn't equal injury is if we have a paper cut. A paper cut typically hurts quite a bit, but the cut is actually pretty small, and in fact, most paper cuts heal in a day or so. Another example that I like to use is if someone pinches you. When they pinch you, you experience quite a bit of pain, but there's typically no tissue damage. And once they stop pinching you, then there's no more pain either. If we look at persistent low back pain, these are typically individuals with pain that lasts for greater than 6 months. They could be 1, 2, 3 years of low back pain. If the idea that pain and tissue damage were correlated, especially over time, then these individuals would think that they need some sort of imaging to look because there's some sort of tissue damage which is driving their pain. However, usually in these persistent pain cases, the pain is actually not related to tissue damage anymore and is acting more as a protective mechanism. The pain is trying to protect that individual from some sort of tissue damage. So it's acting, if we look back at that definition, the potential to tissue damage and not actual tissue damage. So generally for the rehab for these individuals, you have to start with a exercise or movement that doesn't trigger that protective mechanism. This is generally why we start off with some sort of core exercise like a plank or a side plank, because the threat to the person is very low. And then eventually we start progressing the exercises into more and more complicated movements, eventually going into like a squat or a deadlift, where we're simulating either sitting or picking something up off of the ground. Thank you guys so much for watching another episode of Monday Mornings with Michael. I hope that you guys found this episode useful about pain and injury. If you did, please like this video and don't forget to subscribe to the channel.